Hello guys, today we shall be discussing another topic from microbiology, that is human parainfluenza virus. So we are about to discuss regarding HPIV, which is also called as human parainfluenza virus. Human parainfluenza virus. So I hope all of you heard about this virus, that is human parainfluenza virus, which is simply called as HPIV. To which family does this virus belong, guys? Yes, let us start developing from the basics. This virus mainly belongs to Paramyxoviridae. The family Paramyxoviridae. Okay, so this belongs to the family that is Paramyxoviridae. Okay, now as I already told you, what this human parainfluenza virus is about to cause, it causes mainly two diseases. Okay, human parainfluenza virus causes mainly two diseases. What are these two main diseases? One is called as your Croup, one is called as the Croup, and another one is called as the bronchiolitis. Another one is called as bronchiolitis. And all of you very well know the Croup part and this bronchiolitis, both of them are said to be caused in children, right? So these two infections like Croup and bronchiolitis, they both are pediatric infections, right? They are pediatric respiratory infections. Now what age group gonna this virus affect and cause this Croup and bronchiolitis, guys? So that age group which is less than 5 years of age. That age group which is less than 5 years of age. So mainly in these kids you're gonna see this Croup and bronchiolitis. There are different types of this virus. There are different types of this human parainfluenza virus. What are the different types of human parainfluenza virus? There are 4 types basically, right? Type 1, type 2, type 3 and type 4. Very simple, need not to write here. Okay, why I am telling you this about type 1, type 2, type 3, type 4, I will tell you later on, because each type is gonna cause a specific disease in the child. Okay, so first of all let us discuss about the virus and how it is entering into your body and what is the pathogenesis. Okay, so now when I discuss about the virus, let me draw the picture. Okay, so that would be easy for you to understand. Now this is the lipid membrane, right? So this is the lipid membrane, and how many layered is it, guys? Obviously it is double layered, right? So this is lipid membrane, which is also called as enveloped lipid membrane. This is enveloped. In the center you have got a single stranded RNA. This is called as negative sense single stranded RNA. Okay, negative sense single stranded RNA. Surrounding this negative sense single stranded RNA, you have got a capsid that is called as nucleocapsid. Okay, so surrounding this you have got a very beautiful capsid like this. This is called as nucleocapsid. Clear? So what are the things I was discussing? This is called as the envelope. Okay, now this one is called as the nucleocapsid. And next, what is this type of RNA? This is single stranded negative sense RNA, single stranded negative sense RNA, single stranded negative sense RNA. Okay, now on the surface of this envelope, you will find some interesting things, guys. What are those interesting things? You will find some spikes like this. Okay, so you will find some spikes in all the directions like this. And what are the names of these spikes? Before I name you these spikes, I should also mention some more important things. What are those important things? You will find some more tennis racket like sticks like this. I mean, I am drawing it in the form of tennis racket, but actually I don't know what is the shape, but this is just for your identification. Okay, So there are two types of things. There are two types of things that are located on the surface of the envelope. Now these things which I am drawing right now are called as glycoproteins. So what I am trying to tell you is that the pink color and the orange color which I have drawn just now, both of them are called as glycoproteins. Both of them are called as glycoproteins. What is the important thing? The important thing is to know the name of these glycoproteins. So what is the name of this particular glycoprotein, guys? What is the name of this particular glycoprotein here? This particular glycoprotein is named as hemagglutinin-neuraminidase glycoprotein, right? This is hemagglutinin-neuraminidase, neuraminidase, right? So what is this? This is hemagglutinin-neuraminidase glycoprotein. And what is the next glycoprotein here? I mean this orange color glycoprotein which you can see, right? So what is this orange color glycoprotein called as, guys? Anyone? So this particular orange color glycoprotein is called as fusion protein. This is simply called as fusion protein or F protein or fusion protein. Okay, fine. So what is the importance of this hemagglutinin-neuraminidase glycoprotein and fusion protein? Before discussing that, one thing I want you to know is that here these two glycoproteins, HN, simply called as HN glycoprotein, that is hemagglutinin-neuraminidase glycoprotein or the fusion glycoprotein. So both of these glycoproteins are the virulent factors. Why virulent factors? Because both of them are responsible to cause some sort of disease pathogenicity in your body. I'll explain you how they are really virulent to you. But before that, one very important thing you need to understand here is that how this parainfluenza virus basically transmits. This parainfluenza virus basically transmits through the respiratory system. Okay, for example, if I am sneezing, the virus particles enter into your upper respiratory tract and start diseases in the upper respiratory tract. And if the virus enters into the lower respiratory tract, obviously the diseases will start in the lower respiratory tract. So the main way how we are spreading this disease is through sneezing, right? Through sneezing. If my mucus from my nostrils touches to you, so obviously you will also get transmitted with this disease. Okay, so for example, if someone sneezes, the virus particles enter into their upper respiratory tract, and what is happening the moment it enters into their upper respiratory tract, what is happening in their upper respiratory tract, how the diseases are happening, everything we shall be discussing right now. Okay, so let us take an example that a patient has sneezed, right? The virus particles entered, for example, virus particles entered into my body. Now what is happening in my body, I will be explaining you to right now. Right, so regarding the transmission, just now I have told you that by respiratory droplets. This is transmitted by respiratory droplets. And how are you getting these respiratory droplets? By sneezing. By sneezing. So this is the main way of transmission. Now if someone sneezed, right, so how this virus is going to enter into their body? So let me draw the picture, I mean the lateral surface of the face, and explain you how this disease pathogenesis is basically happening. Okay, so this will be the lateral surface of the patient's face, and as I go below, right, so this is gonna be the patient's nasopharynx. Okay, this is the nasopharynx. Fine, I'm drawing it little bit wide because I have to draw some cells over there. And this is the patient's oropharynx. Nice. The nasopharynx and the oropharynx together they join and form something called as laryngopharynx. You can see this is laryngopharynx. So there is a small partition in between the laryngopharynx. dividing the laryngopharynx into anterior trachea and posterior esophagus. The posterior one, the back one, this one here, this is called as your esophagus. So this is a simple anatomy which you have studied from your first, second year MBBS, right? So the anterior part is called as your trachea. So this is your trachea, right? So let me extend the trachea down all the way like this. So this is your trachea, okay? Now in this trachea, what is happening? Let me zoom it out. Let me zoom this thing out. So this is your trachea. This is your trachea. Exactly, this is your trachea. Within your trachea, you have got very beautiful cells like this. These are called as your respiratory epithelial cells. Right? I'm not going in much detail about what type of respiratory epithelial cells are these. It's not that matter of concern in pediatrics. But you just have to know these are respiratory epithelial cells on both the sides. Okay. So let me draw a couple of them on both the sides. Another important thing is that not only this, you have also got some specialized cells in between these respiratory epithelial cells in the trachea. This is the trachea, guys. Remember, this is a trachea picture which I have drawn. Within this trachea, you have got some specialized cells like this in between these. So these specialized cells are called as goblet cells. What are these cells called as, guys? These are called as goblet cells, and all of you know very well that goblet cells, when you activate them, they start releasing what? Mucus. So they start releasing mucus that will line your entire trachea and protect your trachea. Clear? So this is something that everyone has to know. Okay, now what is the thing that you have to know for sure is that once the virus enters into your nasopharynx, okay, I'll indicate the virus like this, guys. I'll indicate the virus like this. So this is the virus representation, okay. So the red dot and 4 horns all the way. So this is the virus which I'm representing. Once the virus enters into the nasopharynx or into the oropharynx, the virus will slide down all the way into the trachea. So right now, the virus all the way, it entered into the nasopharynx or it entered into the oropharynx, right? So right now your virus is in the pharynx. From here the virus will slide down into the trachea. Once the virus slides down into the trachea, what is it going to do? The real topic starts from here. What I'm trying to show you is that what I'll be doing is I'll draw the trachea, I'll draw the epithelial cells pretty big, and I'll show you how the virus is entering into the epithelial cells and how the disease process is starting. But before all of that, you have to know one important thing, that behind here you have got a blood vessel, right? Isn't it? Obviously, you need blood vessel, blood supply to your esophagus, blood supply to the trachea and all. So there is a blood vessel behind it. Now look here, what I am going to do. So this is the wall of the trachea. Okay, so for your confirmation, let me also draw another wall. So this is the second wall of the trachea over here. Clear? And another important thing is that here I have got an epithelial cell. So this is my epithelial cell over here. This is my epithelial cell, respiratory epithelial cell. And next thing is, here I have got what? Here I have got a goblet cell, which releases the mucus. So these are present on the opposite side as well, but I have just enlarged one epithelial cell and one goblet cell. So this is the thing, and behind this, obviously, don't forget that behind this you have got your blood vessel. Behind this you have got your blood vessel. So the same picture I have drawn below. Clear, everyone? Look at it once again. Don't get confused. Clear, everyone, now? Right, I'm going back now. Cool. And by the way, I forgot to mention one thing, that lining your blood vessels, you have got very beautiful cells, right? These are the epithelial cells that are lining your blood vessel. These epithelial cells are called as endothelial cells. These are your endothelial cells. Fine. When the virus is right now in your respiratory tract, what is happening? When you zoom inside the epithelial cells, on the surface of the epithelial cells, guys, on the surface of the epithelial cells, you will find some small receptors like this. You will find some small receptors. These receptors are called as sialic acid receptors. Sialic acid receptors. Okay, or sialic acid sugars. These are called as sialic acid sugars or sialic acid receptors. Now we have got our virus here. Let me draw the virus little bit short. Okay, let me draw the virus little bit short so that you're gonna understand everything. So how did I draw, guys? I've drawn in this way, right? So there is a RNA like this. This is called as a negative sense single stranded RNA. Surrounding this, I have got a nucleocapsid, right? Surrounding that, I have got an envelope like this, double layered envelope. And on the envelope, if you remember, previously I told you there are two types of proteins. One is called as fusion protein, another one is called as HN protein, called as hemagglutinin-neuraminidase protein. So this hemagglutinin-neuraminidase protein joins with, it sits in which receptor? Sialic acid receptor. And second thing is this, the bond between, this is a sialic acid receptor in my body. This is the, let us say, HN protein. The HN protein which is attached to the virus, it fixes in it. And the bond is so weak, it is not that stable. So to maintain the stability, right, once the virus attaches there, it cannot move up and down, right? So once again, if it dislodges from there, it will go out of your body. So the virus has to ensure that it is properly fixing, it is properly adhering to the respiratory epithelial cells. So for that reason, you need a special type of cells, a special type of proteins like this. These proteins here are called as fusion proteins. Clear? So what is fusion protein doing here, guys? I'm drawing a couple of them. Let me draw it. I love to draw anyways. So these are your HN, the pink ones are your fusion proteins. So I've just shown you a simple example. What has happened here? Sialic acid receptor has got attached with HN protein, but for the proper attachment of the virus to the epithelial cell, you need fusion proteins. Clear? Fusion proteins fuse the virus to the epithelial cell. So successfully it has fused. Now what will happen? The envelope will stay outside, but the viral genetic material will enter inside. So now slowly what will happen is that this entire viral genetic material will enter inside. So you can very clearly see the viral genetic material inside. Surrounding the viral genetic material, you have got your beautiful nucleocapsid. The entire envelope, all the proteins, everything is outside. Now, inside the respiratory epithelial cell, you have got a special type of enzyme. So this is a special type of enzyme. And what is the name of this enzyme, guys? The name of this enzyme is RNA polymerase. Okay. So where do I write this? Here. This is RNA polymerase. The name of this enzyme is RNA polymerase. Okay. So this RNA which I have already, the viral RNA whatever I have here is, this is called as, again I am telling you, this is called as single stranded negative sense RNA. Now this RNA polymerase, what will it do is that it will convert this single stranded negative sense RNA into single stranded positive sense RNA. It is converting single stranded negative sense RNA into single stranded positive sense RNA. Now once RNA is synthesized, the next process will be transcription or translation. Obviously it will be translation. So when there is translation, what will be the resultant of translation, guys? Tell me. After translation, after translation, what will be the resultant? Obviously, there will be proteins. And what proteins in this case? There will be viral proteins. It means the virus came inside the cell, the virus genetic material came inside the cell. It modified our RNA polymerase in such a way that it took help of our own RNA polymerase and synthesized its own proteins. It has formed its own RNA viral particles. So you can see a number of RNA viral particles that have been synthesized. You see, number of RNA viral particles. These are many RNA viral particles. Okay. So these are the viral RNA particles. And nothing to forget here. Obviously, on the surface of RNA viral particles, you have got what? These glycoprotein spikes. I mean the glycoprotein molecules in this way, right? Clear? Now, once sufficient amount of RNA particles have been made, sufficient amount of this virus particles have been made, these viruses, what they do is that they destroy that epithelial cell. They destroy that epithelial cell and they enter into the lumen. So slowly they are destroying the epithelial cell, they are causing destruction of the epithelial cell, and now these virus particles are free to enter into the lumen. And obviously, yes, you will see many virus particles entering into the lumen. So these are the virus particles which are entering into the lumen now. You see, many viral particles have entered into the lumen. Okay, fine. So when these virus particles have entered into the lumen, what are they going to do? What are they going to do? Obviously, the rate of transmission now will be high or low. Many virus particles in the lumen. So right now I will cough. Okay. When I will cough or when I will sneeze, what is happening? The virus, all these virus particles will go up all the way, and again you are transmitting to the next person. Clear? Now you might get a doubt. How am I going to cough? Okay, even if I cough, how are these virus particles going out? How are they going out is, once the epithelial cells they get damaged and once the viruses are out, these viruses they enter into the next epithelial cell and again their count increases and again they damage that epithelial cell, come out, they enter into the next epithelial cell and vice versa. It keeps on happening and so on. So as this process is happening, what happens is that these virus particles even irritate the goblet cells. They will even think, why this goblet cell is sitting simply? I am the virus, why this goblet cell is sitting simply? So let's go and disturb it. So it will even irritate the goblet cells. When it will irritate the goblet cells, now look here, the goblet cells will release a lot of mucus here. It will release a lot of mucus onto the surface. So when it will release a lot of mucus onto the surface here, these virus particles get attached in this mucus plug, and once when you sneeze out, the entire mucus plug along with the viruses, they get expectorated outside, and that's how this virus is going to transmit to you. Clear? Now when all this shit is happening here, do you think our immune system is quiet? No, our immune system has to act. So back here you have got your blood vessel. Within your blood vessel there are immune cells like macrophages, you have got your WBC, So what will happen is that your WBC cells, the leukocytes, all the way they come here. And what they do is that your leukocytes will release some chemical. It will release some green color chemical which I am drawing here. This green color chemical, what this green color chemical will do is, this green color chemical, this means this WBC is releasing a substance that is calling the remaining WBC, and this substance is called as chemokine. What is this substance, guys? This substance is called as chemokine. And when it is releasing chemokine by a process called as chemotaxis, the remaining WBC molecules come. They come into the action. So there are different WBC molecules that have come. I mean the remaining WBC molecules have come here. So here are your WBC molecules. And these WBC molecules, these leukocytes, they release a chemical and that is called as prostaglandin. Okay, so they release a chemical here all the way and that is called as PG. PG stands for prostaglandin. But anyways, let me write it down. This is prostaglandin. This is your prostaglandin. And who is releasing this prostaglandin? Your WBC cells. Not only WBC cells, even your endothelial cells that are lining your blood vessels, even they start releasing prostaglandins. Okay, even they start releasing your prostaglandins. And what is the function of prostaglandin, guys? Prostaglandin causes vasodilation. What does prostaglandin cause? It causes vasodilation. And what is the second function of prostaglandin? It will cause increased vascular permeability. It will cause increased vascular PER, means permeability. Okay. So when there is vasodilation, the vessel will dilate. When the vessel will dilate, the pressure inside the vessel will fall or increase. Obviously, there will be decrease in the blood pressure. Clear? So, as a result of vasodilation, there gonna be a hypotension in the patient. Hypotension in the patient. Not only hypotension, as there is increase in vascular permeability. So if this is an endothelial cell, this is a second endothelial cell, endothelial cells are attached to each other. As there is increased vascular permeability, which means, okay, let me show it to you like this. These are endothelial cells, these are endothelial cells, both of them are attached like this tightly. When there is increased vascular permeability, slowly the endothelial cells they stretch. The vessel, it stretches out. When the vessel stretches out like this, you see the gaps in between the endothelial cells, isn't it? You will see minute gaps in between these endothelial cells, as I am showing it to you here. You see minute gaps in between these endothelial cells. So when there is minute gaps within these endothelial cells, guys, what is going to happen in this patient is, all the fluid, whatever fluid is there, all the fluid from the blood vessel, right, all the fluid, it enters into the lumen. You can see the fluid is entering into the lumen like this. You see from here also, the fluid is entering into the lumen. From all the sides, the fluid enters into the lumen like this. Clear? Is this picture clear? You see from here, the fluid is coming all the way down, all the way like this, and it is entering into the lumen. So all the way it enters into the lumen like this. So there is a lot of fluid in the lumen right now. So when all these things are happening, guys, what do you think? What can happen in this patient? What can happen in this patient when all these things are happening? I'll write all of them one by one, don't worry. But when all these things are happening, what can happen in the patient? What is happening overall? What is happening overall is, this is your trachea, right? This is your trachea, and within your trachea, you are having your epithelial cells like this, respiratory epithelial cells, okay, in this way. Clear? And let us say there are some goblet cells in between. And let me also show you that some of the epithelial cells are destructed. There is destruction of few epithelial cells. And let me also show you that there are some virus particles that are released outside as a result of destruction. Okay, they are synthesized and they are released outside. And it is also, I have also shown you that not only the virus particles, even these virus particles stimulated the goblet cells, even the goblet cells released mucus outside. Now the mucus, where is the mucus, guys? Tell me. The mucus is in the lumen. So the mucus is also in the lumen. All the way like this. Not only the mucus, behind this you have got the blood vessel, and there was some inflammatory reaction. As a result of inflammatory reaction, there was vasodilation and vascular permeability increase. As a result, the fluid from the blood vessel entered into the lumen. Very simple. So let me use another color, okay? So fluid from the lumen, blood vessel, entered all the way into the lumen. So you also got a lot of edematous fluid in the lumen, lot of edematous fluid. Now when all this is happening, look at the lumen guys, lumen of your larynx. Is it wide? No, the lumen has become completely narrow because of all the mucus, all the virus particles, all the cells over there. The lumen has become completely narrow. And moreover, whenever there is destruction of these cells, destruction of globulate cells, obviously the globulate cells will swell up, the epithelial cells will swell up. And additionally, as the fluid is coming inside, the cells will swell more. So the entire lumen is swollen now. The entire lumen is swollen. So if from far away, if you look at the picture, this is how it is going to look. This is a trachea of the patient, right? Now if you look inside, this is how it looks. This is all the mucus. You see, the wall of the larynx, the wall of the trachea, the wall of the bronchi, all of these are swollen. The same thing which I have explained here, whatever is happening in trachea, it will even happen in the pharynx, it will even happen in the bronchioles. The same thing. This is happening in the larynx. The swelling is happening, the wall of the larynx, the wall of the pharynx, the wall of the trachea, all of them are swollen now. So when they are swollen, look at the lumen. The lumen has become narrow, isn't it? The lumen has become narrow. As a result of narrowing of the lumen, what is going to happen? Look at the next picture guys. Look at the next picture, what is going to happen. It is very interesting. Let me draw the lateral surface of the face all the way like this. Okay. Right. So this was your nasopharynx, right? This is your nasopharynx, this is your oropharynx, and all the way coming down you have got your laryngopharynx. Clear? Laryngopharynx, and you have got a partition in the center, I told you, dividing it into two halves, and this comes all the way down, divides like this, right? And you have got your very beautiful lungs. Clear? Now, what is happening? What is happening is there is excess amount of mucus accumulation. As a result, the lumen has become narrow. Now, when the lumen has become narrow, now you tell me, will there be sufficient amount of oxygen delivered to the lungs? Yeah. Will there be sufficient amount of oxygen that will be delivered to the lungs? So, for example, if this is your alveoli, this is your alveoli here, will there be sufficient amount of oxygen delivered to the lungs? Absolutely no. So the amount of oxygen that is reaching the lungs is low, that is reaching your blood is low. So patient gonna have decreased oxygen supply, and that is what is called as hypoxia. And second thing, or whatever carbon, if oxygen is not coming, do you think the carbon dioxide can leave out? No. So patient's blood is gonna accumulate. For example, if this is the blood vessel down over here, the blood vessel is right now, guys, keep it in mind, the blood vessel is right now having carbon dioxide. So you give oxygen, I will give carbon dioxide. So oxygen is not entering into the blood. So why will carbon dioxide enter into the alveoli? There are some pressure changes here. So oxygen is not entering into the blood. This is called as hypoxemia. In the same way, carbon dioxide is not entering into the alveoli and exiting out. And where is the carbon dioxide getting accumulated? Within the blood. And this is called as hypercapnia. And this is called as hypercarbia or hypercapnia. So there is decreased oxygen, there is increased carbon dioxide. And when there is increased carbon dioxide, can anyone tell what happens because of increased carbon dioxide, guys? Increased carbon dioxide. Look here. If carbon dioxide levels are more, and this carbon dioxide gonna fuse with water, and what will be the resultant reaction? H2CO3, carbonic acid. and this carbonic acid is a highly unstable molecule. So this carbonic acid will divide into two compounds, and one is called as H plus ion and another one is called as bicarbonate. What is this H plus ion over here? This H plus ion is nothing but called as acid. The proton. And all this thing is happening in the respiratory system. So this results in respiratory acidosis for the patient. What type of acidosis? Respiratory acidosis. So this is all what you need to know, guys. How patient is going to have respiratory acidosis. Clear? Second important thing is that, can the patient breathe freely? No, patient cannot breathe freely. So patient is also going to have difficulty breathing. Difficulty breathing. Okay. After difficulty breathing, can anyone tell what can happen to the patient next? Second thing that can happen is, when the patient is taking air inside, when he is breathing air inside, can the air freely enter inside? No. So the lumen is so narrow, high volume of air is entering inside. The lumen is so narrow. So when the air passes through this narrow lumen, don't you think a sound is produced? And that is called as stridor. That is what is called as stridor. So this stridor, which you can appreciate exactly here, this is happening during inspiration. So I call such stridor as inspiratory stridor. So now patient is having inspiratory stridor. Very important complaint. So patient is gonna have inspiratory stridor. Not only inspiratory stridor, guys, patient as the air is not patent properly, right? Then patient will also have a typical cough that is called as barking cough. Patient also gonna have a typical presentation of cough here that is called as barking cough. Barking cough. Right, okay. Can you please tell me any important thing other than this? Nothing more. Patient gonna have barking cough, inspiratory stridor, hypercapnia leading to respiratory acidosis and difficulty breathing. Okay, these are the important things which you need to know. Another important thing is that I have already told you, and by the way, if you find inspiratory stridor and barking cough in the patient, it means you are dealing a patient of what? You are dealing a patient of croup. So these are the complaints of croup. So now you understood what all things happen in the croup. Why there is barking cough, why there is inspiratory stridor, why there is difficulty breathing, why there is respiratory acidosis. All these complaints which I have just explained you are for croup. And croup even affects your larynx. Croup even affects your larynx. Croup even affects your trachea. Croup even affects your bronchioles, and that is the reason why you call, other name for this croup is laryngotracheobronchitis. The other name is laryngotracheobronchitis. The other name for this group is laryngotracheobronchitis. Now you understood what is croup and how the pathophysiology, everything is happening here, right? Another important thing you need to know here is, guys, I told you this human parainfluenza virus, right? This is of 4 types, right? So what did I tell you? Type 1, type 2, type 3 and type 4. There are 4 different types of HIPV, okay? Now the first two types, HPV1 and HIPV2 are responsible for causing croup, or also called as laryngotracheobronchitis. Next, 3 and 4. 3 and 4, I mean mainly 3 is responsible for causing pneumonia. Croup is lower respiratory or upper respiratory? Upper respiratory tract infection, whereas pneumonia is lower respiratory within the lungs. And type 4 is said to be causing both upper and lower respiratory, but that is very rare. So this is all important things which you need to know. So regarding the pathophysiology, as I promised you that I will mention this pathophysiology, I will write it down manually. So what is the thing is that whenever the virus enters into your body, right? So where does the virus replicate basically, right? The virus replicates in your respiratory epithelial cells. Respiratory epithelial cells. After replicating in the respiratory epithelial cells, what is it going to cause, guys? Will it stay there for a long time, or will it destroy the cell? Obviously that will lead to cell destruction. So whenever there is cell destruction, what is setting in? The immune response. So there is immune activation or immune reaction. Immune activation or immune reaction. Whenever there is immune activation or immune reaction, your WBC come there, macrophages come there, even your endothelial cells, they get activated, and finally what is released, guys? Two important things are released. What is that? One is called as chemokines for attraction, and next one is prostaglandins. And what does this prostaglandins do? Yes, tell me, what does this prostaglandins do? They cause vasodilation. They cause vasodilation and increase vascular permeability. As a result of vasodilation and increased vascular permeability, what is going to happen in the patient? There will be edema, right? There will be a lot of edema formation. As a result of edema, patient gonna have a condition, and that is what is called as your croup. I mean, but the lumen becomes narrow, and finally patient gonna end up in a condition called as croup. So these are some of the important things, these are some of the important steps which you need to remember, guys. Okay, so all of you have to remember it at any cost. So please, don't directly mug it up. Looking at the picture and studying is the most important thing that one student has to do, basically, the medical students basically. Okay, you need a lot of imagination. So if they ask you what is croup, what is the causative agent of croup, what do you see in croup, what are the pathophysiology of the croup, now you know very well how to answer. Now what do I see? Whenever the moment I hear that barking cough in the patient, I think of laryngotracheobronchitis or croup, or also called as croup. Then immediately I need to order a chest X-ray. CXR stands for chest X-ray. When I look at the patient's chest X-ray, what am I going to find, guys? What am I going to find? For example, this is a patient over here. Look, what am I going to find? I'm going to put up an X-ray and show you. Right? So this is a patient over here. Okay, and all of you know that you have got your thyroid, not gland, this is called as a thyroid cartilage over here, right? And all of you very well know this is your cricoid, and beneath the cricoid you have got rings like this all the way, right? And what are these rings called? These are called as your tracheal rings. So now I am showing your trachea all the way like this. Clear? Now within this trachea, what did I tell you? There is a inflammation, and there is complete mucus leading to thickening of the wall of the trachea, isn't it? So this is the wall of the trachea. Let us say this is the wall of the trachea. Okay. Now there is thickening of the wall of the trachea. There is thickening of the wall of the trachea. Now when there is thickening of the wall of the trachea, this is how it thickens, and you see a sign like this. there is a steep sign like this, right? So this steep sign is nothing but called as steeple sign. This is called as steeple sign. Okay, so in a minute I will be showing you an X-ray of a patient with a steeple sign. Clear? So once it is confirmed that the patient is having croup, next thing what you need to do is that you need to start the treatment. Can anyone tell what is the treatment plan in this patient? What will be the treatment plan? The first important thing in the treatment plan is supportive care is very important. What is supportive care? You need to give a lot of fluids to the patient. You need to put the patient on oxygen because oxygen is not going inside the patient. So you need to put the patient on oxygen. I mean, you need to give an oxygen supplementation. Not only that, hydration. So you need oxygen supplementation, and second important thing is hydration. So both of them, they come under supportive treatment. And third important thing what you need to do is that third and the fourth important thing, there is a lot of inflammation. I need to reduce the inflammation. So I need to give such a drug which is anti-inflammatory. And what is that drug which is anti-inflammatory? Dexamethasone. So I need to give the patient dexamethasone. Not only that, another drug I will give through nebulization, guys. Why do I give that drug? I will tell you now. Look here. Right, look at this picture. This is the blood vessel, right? And this blood vessel has got small branches that supply to your larynx in this way, isn't it? And because of the vasodilation of these small branches, the fluid is entering into the lumen. Now what I will do is that I will give such a drug, and this drug will constrict all these arterioles or constrict all these small arteries. When it will constrict all the arteries, do you think the fluid can escape out? No. Do you think the edema will be formed further? No. So there will be resorption of the fluid. The edema content, the edema part or the edema variant, it will be reduced, isn't it? So what drug constricts the arterioles, guys? Yes, very good. That is epinephrine. So I'll give the epinephrine to the patient through the nebulizer. So nebulized epinephrine. So this is the basic treatment plan which you give to the patient, right? So this is all the things which you need to know about the croup, guys, right? Croup or the laryngotracheobronchitis, which is caused by human, yes, parainfluenza virus. Now in this patient, okay, this is all the important things which you need to know for your MBBS exams, right? But what I am going to write now is very important for your MCQ point of view. Just note down these points, that would be more than enough for your MCQ point of view. So I am just filtering from the entire concept which I have explained you. I am filtering some points and putting it down, that will be useful for your MCQs. Okay, but if you are an MBBS student, I am telling you again and again, these lectures are mainly for MBBS students, and that is the reason why I am explaining them in much detail. So you also have to learn in much detail. This is the time when you are learning. This is the time for you to learn the proper concepts, develop proper basics, right? So this part which I am writing now, from now what I will be I am writing now, this will be useful for your MCQs, for your MCQ point of view, because this is a high yield stuff. Okay, so let's start with the high yield stuff. So croup is also called as acute laryngotracheobronchitis. So acute laryngotracheobronchitis. Mostly which age group, guys? 6 months to 5 years. 6 months to 5 years of age. This is the age group which is affected. And what is the etiology? Yes, parainfluenza virus. Parainfluenza virus. Okay, so this is one very important table, guys. This is an important table. Second thing, second important table is that this is an upper respiratory tract infection, I agree, but what type of cough, what type of cough do you see here? Obviously, you will listen to a barking cough. Apart from barking cough, what you can listen? Inspiratory stridor on auscultation. Inspiratory stridor. And obviously, guys, in these patients, there is not much fever. Patients gonna have low grade fever. Low grade fever. So this is the second important box which you need to keep it in mind. And when you do the diagnosis, what are you going to find? Obviously, you are going to do the diagnosis of an X-ray. In the X-ray, you are gonna see steeple sign. You are gonna see steeple sign. Clear? You are gonna see steeple sign in the patient. So this is another important thing. Next, and the last important thing is that regarding the treatment plan, I told you there is only what type of care, guys? Supportive care. Supportive care. Okay. Apart from the supportive care, you can give corticosteroid. And what is that corticosteroid? That is Dexa. And apart from that, you can give nebulized epinephrine. Nebulized epinephrine. So this is another important box. Clear? So these are the important points which you need to know, right? But regarding the concept, that is enough. Clear? So there is nothing difficulty in this. Very simple topic, very nice to understand and very easy concepts as well. Thank you so much for watching. This is the end of the video.